Hi guys! I'm your student nurse Divina Timano from BSN 2-1. For today's storyboard, I'm going to teach you the step-by-step procedure on how to perform anthropometric measurements. So, what are we waiting for? Let's start! The purpose of this is to assess the well-being of the newborn. And for the assessment, we're going to check if the weighing scale is functioning well or not. Then, check for air drops. For planning, we're going to prepare the following materials such as weighing scale, tape measure, pair of gloves, adequate source of light, and lastly is examination table. For the procedure, the first step is we're going to place the weighing scale on the top of the examination table. Then, adjust the source of light, reset the scale to 0. Don't forget to wash hands and put on gloves. Place the naked newborn on the covering. Position the newborn to minimally stress by keeping one hand over the newborn body without touching the newborn. Quickly note the weigh. Then, after that, remove the newborn from the scale and continue with care. Remove the gloves and wash hands when care is completed. Lastly, document the weigh in the newborn's medical record. The average weight of a newborn is 6.5 to 7.5 pounds. It is low or arbitrarily low if it is below 5.5 pounds. Procedure with assessing the head circumference. With the infant lying on a supine position, on the examination table, place the tape measure behind the infant's head and run across the most prominent part of the infant's head. So the normal value is 34 to 35 centimeters. Next is assessing the chest circumference. With the infant lying on a supine position on the examination table, place the tape measure behind the infant's back and run across the chest. Make sure the tape measure is running across the infant's nipple line. The normal value is between 31 to 33 centimeters or 2 centimeters less than the head circumference. Assessing the abdominal circumference. With the infant lying on a supine position on the examination table, place the tape measure behind the infant's waistline and run across the infant's abdomen just above the navel. The normal value is between 31 to 33 centimeters. Assessing the infant's length. With the baby still naked, rest the baby's feet with your non-dominant hand. Position the tape measure behind the infant's sole. Lift the infant in an upside-down position and run the tape measure from the sole behind the leg, thigh, buttocks, back, nape, occipital area to the anterior fontanelle. If the infant is weak, it is better to use the lateral position with the baby on top of the examination table. This is also a safe method in measuring the infant's length, especially if the nurse is alone. The normal value of the infant's length is 50 cm or 20 inches. Then, continue with other care. Lastly, remove gloves, do hand washing, document the procedure and findings in the infant's chart, and refer any abnormal findings to the attending physician.